Good morning, everybody. We'll call this morning's meeting to order for Tuesday, October 5th. Our first item is the approval of the agenda, and I did hear from Sheriff Empting that he would like to withdraw item number 5 until next week. So if we approve the agenda, that would be with that change made.
Move to approve the agenda with that change.
Second the motion.
We have a motion by Commissioner Cayley and second by Commissioner Mojo. Any further discussion on the motion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed, the same sign. Motion carried. We will move into citizens to be heard. Do we have any citizens to be heard this morning on items not on the agenda? Any citizens to be heard? Anything online?
Nothing, Mr. Chair.
Thank you, Steve. We will move into the approval of the bills and vouchers.
So move.
Second.
Motion by Commissioner Mojo, second by Commissioner Cayley. Any further discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed, the same. Motion carried. Approval of minutes from September 21st.
Move to approve.
Second.
Motion by Commissioner Gross, second by Commissioner Mojo. Further discussion? Comments? All in favor signify by saying aye.
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 Opposed, the same sign. Motion carried. We'll move into our 8:35 item, COVID-19 update. Public Health Director Kathy McKay and Jamie Hennon and Becky is back again as well. Good morning.
Good morning, Mr. Chair and Commissioners.
Good morning. Kathy, I know while you're getting that ready too, maybe when you're done with your report, while you're here, we can just talk a little bit about our discussions that we had at PIC regarding the, okay, I'm catching you.
Just a moment of,
surprised.
let me remember what we discussed.
Well, it was based on the conversation that we had with the masking deal.
Oh, okay,
So,
will do. Okay, so here's our updates on cases. So on September 27th, we had 290 active cases in Clay County. And now you can see October 4th, we went up a bit to 310. Cass County also went up from 619 the previous week to 755 cases. And then in Minnesota, we're seeing some increases in cases across the state from the 27th through the 4th, and also increases in the cases in North Dakota as well. The next slide is active cases by age. So you can see that we're still seeing the active cases, mostly in the school age, and then we're seeing some in the 20s and 30s as well. But again, it's active cases have been majority of the younger age groups. Our cumulative cases by age on the next page, so our total is 9,659, and this has been as reported throughout the pandemic. So there's the cumulative cases, and the 20 to 24 remains the highest at 1,237 cumulatively. The next slide is the cases per week. So we're seeing the number of cases from July and now through September. So it just gives us the trends of the cases per week since July.
is that following? I was listening to the national news, and they said the trend throughout the United States is that it's coming down a little bit. Are we seeing that here yet, or?
Yeah, it varies state to state. I don't know if nationally it's actually, it may be, I didn't hear that on the news, and I don't know if Becky, you've been aware of the national trend at all?
I have heard the same thing, that on national wise it is trending down. However, that's not the case yet for Minnesota.
The next one shows our cases per week and back from March of 2020 through, our current. So we're looking like we are obviously in the fourth wave. And from our numbers at the same time for the previous year, we are higher than what we were back in that same time frame in August. So, and again, we repeatedly say that there's always that delay in reporting cases. It just takes a while for all the cases to be counted, so. And we'll go to the next page. Becky will talk about that.
So this graph shows Clay County deaths reported by week. We didn't have any newly reported deaths from last week, so we're still at the 97 total deaths for Clay County. And this graph depicts the number of COVID hospital admissions per week for Clay County residents. So we're still seeing an elevated number of hospitalizations. There were 11 COVID admissions during the week of September 19th. And then for last week, we've had 5 reported so far that have been hospitalized. Again, that number may go up as the data has a chance to catch up.
Are those new admissions, or are they currently in the hospital?
So those are new admissions per week. Some of them have been discharged, some of them have not. Then this slide breaks down recent hospitalizations of Clay County residents by age. As you can see by the pie chart on the left, the majority, or 65%, of those admitted to the hospital are under the age of 65. The bar graph on the right breaks down the admissions by age group. And so we've had 2 more pediatric admissions since last week, one in the 10 to 14 age group and the other in the 15 to 19 age group. And we've had a total of 57 admissions in Clay County since August 1st, average age being 53. And then this slide again shows statewide hospitalization data for North Dakota as of yesterday. There are currently 157 hospitalized due to COVID, with 24 in the ICU. The number of hospitalized has increased from 133 last week at this time, as well as the number in the ICU. That number was 21 last week, and it's at 24 currently. The chart in the middle shows current hospitalizations broken down by age groups. You can see there are, unfortunately, 5 pediatric admissions. The chart on the right shows age groups of the total admissions throughout the pandemic. So the number of COVID admissions in North Dakota is actually at the highest right now since December of last year. And then this is the updated graphic from the Sanford Medical System that they update every week. This is updated as of September 28th. Again, the red people represent those that are not vaccinated, and the white represent those that are vaccinated. The overwhelming majority of hospitalized cases continue to be among the unvaccinated, and all of the 28 patients currently on ventilators are unvaccinated. And then this is the data on breakthrough cases. So we have seen a little bit of an increase in the number of reported breakthrough infections. So we're a little over 1% now for Minnesota. Breakthrough hospitalizations are still quite low at 0.053%, and breakthrough deaths are at 0.006%.
Okay. Jamie.
Good morning. So looking at the vaccine that's been provided by Clay County Public Health, our total is 15,587 doses, and things to continue to trickle, but local public health is focusing on first and second doses, and vaccine is plentiful in Minnesota and in our community, but we provided just 24 doses last week. So we are working with Minnesota Department of Health to gear up for boosters and also for flu vaccine together. So we'll be doing that, doing some planning. Just want to stress that those boosters are for Pfizer only. So if you've had a Pfizer first and second dose, you can have a Pfizer booster. And then going to the next slide, looking at the statewide data, all across Minnesota, individuals with at least 1 dose of vaccine were at 72.4%. Last week it was 71.7%, so slow progress. And then people with a completed vaccine series, 68.8% in Minnesota, and last week we were at 67.9%. And then you'll see the breakdown by age group there for at least one dose, and those completing the series as well. And this is for 12 and over, so that's what we've been tracking. And then I'll just talk a little bit about what we are doing this week for our clinics. We have a clinic at the Family Service Center, and again, we've been rotating over the lunch hour and then doing an evening clinic. And so our clinic this week is on Thursday at the Family Service Center from 2 o'clock to 6 o'clock. We're offering first and second doses of Pfizer, and we also have Johnson & Johnson. Offered Johnson & Johnson last week as well. With those, we also fill in, we go to the long-term care facilities that have a single dose, we go to people's homes that are needing that dose, and over to the jail and juvenile detention centers. So at the end of each clinic, that's what we do with doses. We also are planning to do a special population group that we're going to be working with Moorhead Housing on this week, and that'll be on a Thursday clinic. And then we're doing some second doses at the Ullin School to finish up Pfizer second doses, and that'll be on Wednesday. And then, did you want me to talk about this report? Okay.
I have a question quick on your vaccine clinic. The amount of folks that you served in that last Thursday, were the majority of them second doses, or did you?
The majority of that was Johnson & Johnson.
Any other questions for Kathy or Jamie or Becky?
She's
got
one more.
We got one more, okay.
Kathy asked me to share the results of the survey that was completed or still is underway for staff.
Yes.
And so looking at the total number of employees, 619, as of Monday, 60% of those employees had completed the survey. 87% of those that responded, again, we're not finished with the survey, but of those that responded, 87% were vaccinated, 12% were unvaccinated, and 1% was partially vaccinated.
Just maybe a follow-up comment to that. I had some staff reach out to me questioning why we were doing that. And I think it's important to note that that's something that this board had asked for, and feel that it's really important for us to get a good handle and understanding about the vaccination status of our staff, so we can make policies to move forward. And so it wasn't staff driven. It was something that this board really feels that it's important. So if it's completely confidential, it's information that we will be using. So I encourage you, if you've not had an opportunity to reply to that, to please do so. It will really shape how we look at masking mandates or other restrictions moving forward.
I want to echo that, and this kind of dovetails into where I wanted you to stay regarding the PIC meeting, where we spent some time talking about the board's decision last week. And I know in the motion that was made, it was suggested that we review it in 2 weeks, and I'm assuming that's a good thing, and I'm assuming we'll keep doing that, But part of what, through the PIC meeting, and this is what Commissioner Mojo talked about, this wasn't staff that requested this survey. This survey was requested out of our PIC meeting. And it's done for a couple of reasons. It's done to get ready in the event that the federal process that's out there does hold up and it's implemented, which would require us to do it. So we wanted to be ready for that, so we just thought on a volunteer basis. And again, we don't know who those people are, and that wasn't the intent. The intent was so that we can have better data to make better decisions on what goes on within our county campus, to keep our employees safe and to keep those who come here safe. It's as simple as that. And so I think these numbers are encouraging when I see 87% of those that have responded have been vaccinated. I think that's good. But Commissioner Moschel, you wanted to?
I didn't have a comment. I just wanted to clarify maybe the math on that. So is that, of all the responses, 322 of those of staff are vaccinated?
And it's as of Monday, there were 373 responses.
Okay,
Of those, the breakdown of the numbers, fully vaccinated, 326, not vaccinated, 43, and partially vaccinated, 4. And so what I shared with you were the percentages of those that have responded.
so it looks like we are at least 50% staff vaccination fully.
And I'm assuming, and I'm kind of looking maybe back at Darren for a head nod, but when we talk about 619, does that include our variable? And right, right. So for the people watching here, when we talk about variable hour, those are people who might be called in at certain circumstances to fill shifts and that type of thing. And, you know, they're included in our total number of 619 or 620, whatever that is, but they're probably the least likely to maybe even receive the information, the request for information, and to respond. So, but the fact that we had 326 fully vaccinated out of 370 is, I think it's a pretty good number. Hopefully that can still go up.
Yep.
Or Becky would like to see that go up. But, so we, you know, so going back to the PIC meeting, and I guess I'm kind of getting into my portion of the committee report regarding that right now while you're here. So we asked for that information. We want to kind of start to understand, maybe separating out what goes on within our campuses versus the rest of the community too. So that's kind of a deal that's important to us. If we have a significantly high number of vaccinated people here, for the workers, you know, it might mean that we do some sort of a different type of a masking deal. I think right now when we have people come in, we ask them to wear masks anyway.
Right.
As a matter of fact, I think in some instances, it's required of them to come in, right, Kathy?
Correct.
You know, so, we didn't, in our PIC meeting, we didn't come up with a reason yet to withdraw our current plan for masking, but I think Kathy assured us that she will be monitoring us, and at the earliest possible time, we'll see if we can remove that. Nobody likes it.
Right.
I don't like it. That day when I sat with my mask on in that room, I didn't like it at all. It's uncomfortable.
Right.
And I was at another meeting yesterday with Mr. Melton. I was over an hour and a half in a meeting with a mask on. I didn't like it. But, so, and I don't know, Commissioner Mojo or Steve or Brian, anybody else from PIC that was there, but I think right now, unless you come with us next week with something else, we'll just have to continue this for a little while until we get through this, hopefully this peak, and if it's true that, and the trend is coming down, we can maybe
Yep, that'd be positive.
sooner rather than later, but.
Right.
Anybody else? Commissioner Moser, do you have anything else?
Yep. I think it's really important to stress the piece of the survey. That's something that's really important for us as we develop what a policy looks like. But I'm struggling a little bit with consistency, and I had some business to do in the Family Service Center last week, and also had walked around the campus a little bit, and there's not everyone is following it, and I that's personal preference, but I think it develops, there's problems in terms of who's enforcing it, and is it the greeter at the Family Services Center's job to do that, and once they get by, you know, so it's, you know, the board decided to put that on there, but I just struggle a little bit with the inconsistency piece. You know, I think what my argument was a week ago is that as intelligent adults, we can make our own choice to space ourselves out and use hand sanitizer. And as a board, we've made choices to put barriers up and keep staff as safe as we can, but it's just, I don't know, Steve, if you have any comments on that, but is it a department head's job to follow up on that? I mean, they have a lot of important business as well.
Yeah, we certainly have asked reached out to all of our department heads and made them aware. We handed out a masking policy that Kathy updated along with Darren last week to all of our employees. So the expectation is that they continue to wear masks. I think one of the things that I've heard from the Family Service Center is it's not necessarily just our employees. It's a lot of the people that are choosing to come in for services that maybe one aren't coming in with masks or two are coming in with masks and once they get past our greeter are taking them off.
Last Thursday and Friday, I was over at the Family Services Center as well for 2 retirements that went on over there. They had little internal deals for them, and I happen to know both of those people who were retiring, and I've known them for a while, and I served with them on insurance committees and things like that, and they just kind of had it in the hallway up on their floor, and every single person was wearing a mask, and I'm presuming I'm safe in saying that every one of them wishes they didn't have to. But they did it. So hopefully this will be short-lived and it doesn't become the new normal for us. So. All right, I think thank you for staying around for that, Kathy. And anytime, as far as you're concerned, anytime where you think there's something that could change, you can let us know. And if you want to talk about it further, or you think there's some more things that you'd like to see happen through PIC, we can have a PIC meeting on the spur of the moment if we have to. So just so you know that. So
Thank you.
all right.
Okay, great.
Okay. Thank you. All right. Next, we have a request from William and Keirston Kopp. I'm assuming I'm pronouncing that name correctly, regarding a repurchase of tax forfeited property. And I'm assuming you're Attorney Dan?
I am.
All right, good morning.
Good morning.
We have received information in our packet, and there was a summary a good explanation that you provided our board. There was a resolution, I believe our county attorney has made a couple of.
Mr. Planbeck prepared it initially, but I did make some changes to include some of the cost pieces in there as well.
So the resolution that we have includes your changes, is that correct?
Correct.
Okay, all right. Okay, so you have the floor.
And I have seen Mr. Melton's changes to the resolution, and we're fine with that.
Okay.
And Mr. Kopp is here, present, in case the board has any questions.
Okay.
It's a situation where they bought this home back in 2011, 2012, and without a mortgage, they paid cash. But almost from the get-go, they got behind on their taxes and never were able to catch up for a variety of reasons, and I don't think we need to get into that, but there's a lot at stake here, and there'd be a substantial hardship if they weren't allowed to repurchase the house.
My only thought on this process is with that type of an equity, why you'd think maybe a home equity loan could have resolved that problem a long time ago. For the amount of dollars we're talking about compared to the value in it. I'm not going to get into the personal business, but anytime that we can get somebody back to their property, I think it's a good thing. That's the position that the board's always had. I am extremely concerned and obviously now therefore be it resolved, item number 4 is crucial, that before we do release anything, that dollar amount is paid in full.
That's understood.
Okay. Is there any questions of the board? Have you had a chance to read through everything? Are we good with the request?
I'll make a motion to approve.
Second.
We have a motion for Resolution 2021-45. Was that the correct number now, Steve? Or,
That is correct, Mr. Chair.
okay, so we have a motion for Resolution 2021-45, and that was by Commissioner Gross and second by Commissioner Mojo. Any further discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed, the same sign. The motion is carried and your request has been granted.
Thank you.
All right, thank you. Item number 4, request to approve resolution 2021-44 for setting date and terms for tax forfeited property. Jackie,
Good morning, Chair.
good morning. I think this is your first time coming before us.
It is, yeah.
Well, welcome.
Yes, thank you. Thank you. We just have one tax forfeit property on the list, and just wondering, or asking that you approve that as presented.
All right. And that's attachment C. Any questions?
And when, the sale will be December 9th
Yes.
at the Government Center?
Center, yeah.
Okay, thank you. I'll make a motion to approve Resolution 2021-44.
Second.
Motion by Commissioner Mojo, second by Commissioner Kaylee. Any further discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed, the same. Motion carried. Thank you.
I just have a question. Did we approve on the prior one, Resolution 45 first?
Yes.
Okay,
Yes, we did. I think it's just the way they were
that's fine.
put on the agenda. As long as we get the numbers right.
Yep.
All right, item number, the 9 o'clock item number has been taken off, so we will move into request to fill 2 vacancies for full-time correctional officers. I cannot believe we're seeing you here again.
I wish it wasn't true.
I know. Good morning.
Morning. So I am here requesting to fill 2 full-time vacancies. We had 2 resignations within the last week and a half. One individual's is leaving us to go to the Otter Tail County Jail. That individual's been commuting from Fergus Falls for the past 3 years and just felt like it was the appropriate time to make that move. The other individual is accepting a job at juvenile detention. So both the positions are within our budget. They're part of our DOC staffing plan. They actually would have probably a cost savings to the county. Both individuals have been here for about 3 years. So are part of the grandfathered in benefits, as well as they're on step, I believe, 4 currently.
Move to approve.
We have a motion by Commissioner Kaylee. Do we have a second?
Second.
Second by Commissioner Gross. Any further discussion?
Well, I think maybe we did have this discussion. Commissioner Gross had some business last week, so I did sit in on the PIC committee. And we talked a little bit about your staffing numbers and how it's changing the amount of folks that can be in the center without, some transportation costs. Do you want to update the rest of the board a little bit on that?
As far as the housing in other counties, so we are, I think, the board was made aware, I think, maybe a month and a half ago that we started housing inmates in other counties. As of this morning, we have 12 individuals housed in a different county currently. It's being done in order to meet our DOC staffing plan. We have to meet certain staffing to inmate ratio numbers in some of the housing units, and based on classification, we're just having to house those individuals in other counties. Last week, we did make some changes within the facility to eliminate the number of individuals we had to send out. But as our population continues to increase, we're having to send more and more individuals out. As of this morning, we're sitting at 116 inmates in the facility, which is kind of right on that border of potentially having to ship out even more individuals to other counties. So it is a struggle. As some of the commissioners are aware, I mean, we had to do this prior to opening the new facility, and it wasn't something we ever anticipated having to do ever again. And it's become a little bit of a struggle to find individuals to house in other counties, but we're managing it. Just having to work through it.
So, if I may, Mr. Chair, thank you. Obviously, we've had lots of conversations on workforce issues in all departments, not just yours.
I wonder, Commissioner Mojo, we're getting off the motion just a little bit, so I wonder if we could.
I'm not, I'm trying to figure out,
Yeah, I'm just suggesting we vote on the motion
That's fine.
itself, and then we can
there's,
continue.
a motion in a second, it's fine.
Okay. All right, so I think all in favor of the motion signify by saying aye.
Aye.
Opposed, the same. Motion carried. Okay, now,
My question was, what are other counties seeing for workforce? Are other jails seeing shortages and open staffing patterns as well?
Yes, there are a number of counties that are having issues. Cass County, just across the river, I don't want to misquote their numbers, but they are in a very similar situation that we are. I know Beltrami County is in a much worse situation than we are. I think it's improved a little bit up there. They were short 21 full-time officers. I think it's only 18 now. That's still a very high number. It's pretty even 50-50 of what they have open and what they have currently working for them. I know County Administrator Steve Larson sent out some articles yesterday to myself. Dakota County down in the cities is short a large number of officers, and they are actually housing 40 inmates in Wright County right now to meet their staffing plans as well. Other facilities aren't seeing as drastic of numbers as we are. And I was thinking about this the other night, and when you compare our community to other communities, the thing you have to remember is we're competing with another jail that's much larger to us for the same individuals to come work for us, as well as we have a juvenile detention center that in a lot of cases we're having to compete for those same individuals as well. So I think there's some factors. Yes, we're a larger community. We have the two communities here, but I think when you compare us to other areas and see the number of staff that both facilities or all three facilities need to operate, it's much larger than other communities our size just because of the three facilities are running in this community.
Thank you.
anything else? Okay. Yeah, and we'll talk a little bit more about what we discussed in PIC during our committee reports as well, so. All right, your request has been granted.
Thank you.
Thank you. All right, next we have Rhonda is here. We have a request to fill vacancy for full-time case aide position in Child and Family Unit.
Yes.
Good morning, Rhonda.
Good morning, Mr. Chair, Commissioners. Okay, I am here as well to request approval to fill a vacancy that we will actually have the first of the year, January of 2022. We're fortunate to have a staff person able to give us that length of a notice, which often doesn't happen. This is a case aide position for our agency. The current staff primarily focuses on child supervised visits for our kids in placement, along with a multitude of other administrative tasks in terms of helping the child protection workers with their caseloads. This case aide has been with us for a number of years. She actually has been going to school to get her social work degree, so she's actually going to be a full-time intern with us starting in January with our social workers. So that will leave her case aide position open. So I'd be looking for a motion to fill the position with any potential backfill.
So move with backfill.
Second.
Motion by Commissioner Mojo, second by Commissioner Kaylee. Any further discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed, the same. Motion carried.
All right, thank you.
Request is granted. Thank you, Rhonda. Committee reports. Mr. Kaylee, would you like to start today?
Sure. I think I only have one. On Friday, October 1st, I attended the First Fridays event put on by the Food Partners. At that event, we honored Kim Lepetsky, who is retiring from Fargo Cass Public Health. And it was said that if you've been involved in any sort of healthy food or active living initiative in the area, you've worked with Kim. So she just has really put her fingerprints on a lot of healthy living initiatives in the area, and we thank her for her service. At that meeting, the theme was on seed saving. There were 3 presenters: Don Kinsler from NDSU Extension, Dan Goering, who is one of the founders of the Tomato Seed Savers Club locally, which is a group that I'm a member of, and also Jamie Holding Eagle. Jamie talked about indigenous cultural ties to seeds and how seeds connect people. Don Kinsler talked about some of the nuts and bolts of seed saving, and Dan Goering talked about tomatoes specifically, since that's his thing, but preserving the genetics of a lot of our food seeds and why that's so important. So that was a really great meeting. The next one will be Friday, November 5th at the 701 Eateries, and they will be talking about fall flavors with a mixture of chefs and mixologists at that meeting. Thank you.
Frank, I'm assuming you probably have, do you have?
No, I missed last month's meeting. I didn't have any meeting, last week's meeting. And I didn't have any meetings this week. But from the week before, I had to pick meeting, and I know you reported on that, and we discussed that here again today. So those are my meetings.
Okay, thank you. Commissioner Mojo.
Thank you. Last week, as I referred to, I attended the PIC committee meeting. We talked about the mask policy that the county board had acted on, and the information that, in terms of the policy that our HR director had sent out in terms of collaborating with public health and what other municipalities are doing. So I appreciate their quick work on that, and talked a little bit about you know, what benchmarks are we looking at? Are we looking at staff positivity or staff, you know, if we have staff that are currently out with the virus? And so I think that our direction is to make sure that we get a fairly good grasp on those numbers, so the board can make decisions hopefully in another week to see where we're at. You know, I certainly feel like there's a lot of great work that everyone has done, and I think that it's really important to note that our staff, we have the greatest staff. They really have done so much in the last 18 months for us, and you know, it's important to hear from them in terms of how we craft a policy going forward. We also talked about the hiring practice over at the correctional facility. We know that there's a significant amount of turnover that has happened, partly because there's some lateral movements that can happen with some pay increases. So I think it's important for us to look at our PDQs and see if there's some inconsistencies before we make any adjustments. I certainly feel like it's not only a correctional facility issue, because we are seeing so many openings, but there might be some opportunity to make some tweaks to help with staff retention and recruitment. So that was the PIC piece. I attended after that the American Rescue Plan Committee. We had a proposal from A Place for Hope, Daryl Vasvik. We're currently discussing how that could play into it, any proposals. They did receive a van, if you recall, with CARES Act funding for food delivery to rural areas within the county, and there's a fairly good proposal there. We talked a little bit about public health needs going forward, if there are any outstanding items that public health is needing to secure in terms of dealing with COVID going forward. Had a discussion on our decision to possibly have a proposal for this board in terms of a cultural liaison. I think, if I'm right, Darren, you're working with other counties to get a description in terms of exactly what that would be. Commissioner Campbell and I are really excited about the possibility to work with all of our different cultural groups within the county. It could be a really good opportunity to make sure and get information to people that may not be getting it. And then talked a little bit about proposal from Ellers Services, and we will be meeting again in a week. Last week, I also attended the AMC Extension's 100 Rural Women Conversation event. Really good information from all over the state in terms of people in rural counties as well as rural metro areas about the needs and areas that we can all collaborate during COVID to continue to serve the people we serve in the best capacity. Yesterday, I attended the Resource Recovery Campus committee meeting out at the job site. Great work is happening out there. They're currently pouring walls for the pit, and rebar is being delivered. So if you haven't driven by, make sure and do, because there's a lot going on out there. Talked a little bit about our upcoming issues. We really are taking advantage of such a great October, but know that freeze up will happen at some point. So talked a little bit about how that could change it. Our ICF blocks did get delayed for delivery until spring, which I think is a good issue, because then we don't have to store it over the winter. And talked a little bit about continuing to have discussions about backup power and what needs we have with that, with the battery, what needs to be battery backup and is it scale house, is it offices, what is it? And is it a generator, is it battery, what is it? But that concludes my reports.
Commissioner Gross.
Yeah, that one item, didn't add, the township chairman requested a meeting, which will be November the 15th. He's organizing a meeting for the townships. Be held at the Dilworth Community Center, more likely starting in the 8, I don't know, he'll send out a letter, but he'll be in that 8 o'clock area.
Okay,
So it'll be November the 15th at the Dilworth Community Center.
thank you.
That's it, thank you.
Thank you. All right, my meetings, I'll start off reporting on the Personal Issues Committee meeting. We went through the mask policy issues that were addressed this morning, and I do kind of like Commissioner Mojo's term in terms of looking at what benchmarks might we be looking at to establish. I think that's a really good term to put on it in regards to how we're going to eventually be able to come with the proper criteria for removing that. We spent considerable time talking about hiring practices for the correctional officers, and this goes to what Justin was here for this morning, and I made the comment that it's kind of in a roundabout way that it's funny to see him here, because I think we're going to continue to see him here on a regular basis until we can figure something out. There were 4 different areas where Sheriff Empting and his group brought forward to us that may need to be looked at. One of them was a pay scale, another one was abilities to advance, and another one, Commissioner Mojo, well, there was some discussion about shift differential pay. That one can have an awful lot of other ramifications in doing so, but it's something that certainly needs to be looked at. It was also brought up That's the same thing was brought up amongst some of our members in our 11 county regional juvenile facility as well. And then the lateral pay issue, which also brings some problems with it anytime you try to mess with those types of things, but they're all things that we need to review. I'm going to shift from that to going right to that to talk about the meeting that I attended yesterday that I attended on behalf of Commissioner Ebinger regarding use of force, the use of force legislation. That meeting was yesterday afternoon, and those in attendance were Senator Eakin and Representative Marquardt. Representative Keeler was there online, but I don't know if there was some technology issues or something because she wasn't on very long, and she was gone. Then there was Shannon Monroe, Tori Jacobson from Moorhead PD, Mark Empting, Mayor Carlson, Lisa Bodie, John Shockley, Brian, and myself. And we had some really good discussion there, and there was a lot of things that we were sharing with those legislatures in regards to not only the use of force, but how, one of the things Representative Marquardt brought up is what's our plan B until something changes, and our plan B is that we just have to do with what we have right now, and it's when you listen to the sheriff and you listen to the Moorhead Police Chief, it's really putting a strain on their personnel with all of these things going on, and in terms of why I'm kind of correlating that with the issues regarding the correctional facility is they were talking about all of our institutions right now where people go to for becoming a correctional officer or law enforcement. All of those numbers in those educational systems throughout the state of Minnesota and nationwide are all way down. The numbers of those wanting to get in law enforcement are down, and somebody used the term yesterday that unfortunately a lot of it is because the lack of support for law enforcement that there is today by the public. Now, so there needs to be some work done on getting that back as well. Certainly, I think in the Fargo-Moorhead area, I think we really support law enforcement here quite well. They've done a really good job, and we haven't had any issues. However, it's just something that a lot of more people are leaving that field than coming in, and we need to find out why and how we can address that. But I don't know, Brian, you were there, and you and Mr. Shockley kind of talked about the legal stuff that's going on. Would you care to jump in?
Thank you, Mr. Chair, Commissioners. I think maybe just the rest of maybe the update. We had a meeting back on September 9th with a large group of law enforcement, Fargo, West Fargo, Grand Forks, and then all the senators, Senator Eakin, Representative Marquardt, Representative Keeler, and then several other at that time to have a discussion about the use of force statute, and then really mutual aid and the question of providing mutual aid. Right after that September 9th meeting, it was a good meeting and a good discussion. I would say pretty spirited. Right following that, as of September 13th, there is a lawsuit that was filed by the Sheriff's Association, Chiefs of Police Association, and Police Officers Association, which was asking for an injunction to be put in place, saying that the questioning whether or not this statute it has so many new issues and so many things that there's not enough time to have done training, so they asked for that injunction, and that injunction was actually granted as of September 13th. So currently, the law is in flux. And so that was some of the discussion that we had yesterday. Even with that injunction being in place, at least for now, mutual aid between North Dakota and Minnesota and between Fargo and Moorhead is still not occurring, just because there's so many questions being asked. whether or not that injunction could be appealed and lifted. They're planning on briefing that here pretty quickly and trying to get some answers to that. So there was a lot of discussion about that yesterday with Representative Marquardt and Senator Eakin, trying to determine, whether or not to wait on and see what the results from that lawsuit could be. But also, I think there's a lot of good discussion from Senator Eakin of saying, there are some unintended consequences that we're obviously seeing, and to look at potentially tweaking and working on legislation as well. So, yeah, I thought there was a lot of good discussion yesterday, but I think that was a lot of the pieces that were going on, both talking about the lawsuit, talking about possible future legislation, and really not, at least right now, getting an answer on mutual aid, but I guess just trying to go forward as best we can right now.
Right, I agree. I think both Senator Deacon and Senator Marquardt, even when and they even said that during this whole process, all of the, like the police association, sheriffs, none of them spoke up against that legislation at the time it happened. But unfortunately, it was a kind of a rapid deal that went through the legislature, and it wasn't until after that was passed that all these unintended consequences started to show up regarding the entire perimeter of the entire state of Minnesota and all of its neighbors and their concerns about wanting to do mutual aid. And so that's the issue now, and I really appreciate, Kent Eakin really spoke up and said that, and Representative Marquardt, maybe the best thing now would be that if the court would just throw that out right now and send it back to the legislature for reconsideration, I think would probably be the best thing that could happen. I think we'd probably be wishing pretty high for that to happen. But the legislatures were very keen on trying to find what solutions we're looking for, and maybe what solutions our counterparts, what would satisfy our neighbors to maybe to be able to come back and do what we've been doing for the past 40 or 50 years together, and what changes in that language could happen. And I think we're all very pleased to hear that on the part of our legislatures, and we'll continue to monitor that. So that was those two committee meetings. I did also attend the American Rescue Plan Act Committee, or CARES 2 as we refer to it, on the 29th. And that has been discussed by Commissioner Mojo, so I won't go any further into that. And also I attended yesterday the Resource Recovery Project, and I do not have any more to add to that than Commissioner Mojo has reported. So I'll let Steve, if you're ready for your report.
I do have something really quick, sorry. I know that on our agenda, but our upcoming meetings, the Moorhead School District has their open house of their Career Academy this Friday, but also the Barnesville School District has a new elementary school. That open house is Wednesday from 5 to 8.
All right, thank you for that. Steve.
Thank you, Mr. Chair. Last Tuesday, I met with Derek LaPointe, Executive Director of Downtown Moorhead, Inc., and a number of shared issues, received some updates on things they're working on, and also to kind of begin to talk a little bit about, in the event that the county does end up providing financial support next year, what that will look like. On 28th, I also met with Darren and Kathy, Brian, in relation to some of the mask policies, and making sure that we had the proper signage and notifications done. On the 29th, we had a PIC meeting that has been addressed already. Also on the 29th, participated in American Rescue. That has also been covered. Had a department head evaluation that afternoon, and also met with our regional administrators here in the Fargo-Moorhead areas. We discussed ARPA, the regional dispatch facility. They have, Cass County has had their initial meetings with the architects in drawings, and they're continuing to work through the scope of that contract. And then also, of course, talked about COVID. 30th, worked with Colleen on the board preparation. I had a department head evaluation that afternoon. We did some further research on some ARPA issues yesterday, and also met with Mr. Milton on a variety of different things, and then also participated in the resource recovery facility meeting that's been discussed. We did, just to update the board, we did close on our 2 bonds on Friday. Those funds have been received by the auditor's office, and Lori has begun to make adjustments or payments to costs that we've already covered with county funds. Again, one of your meetings, the Heart of Clay Dessert and Social Fundraiser is tonight at 6 p.m. Again, they are our ministry for our correctional facilities, and they do a lot of great work here. It's a night of celebration. Commissioner Mojo mentioned the Career Academy, and again, just to kind of follow up with Jamie, again, a vaccine clinic on the 7th from 2 to 6, Pfizer and Johnson & Johnson. No boosters, appointments only. And then just to address, both Darren and I are going to be gone Wednesday afternoon through Friday at our respective association conferences. And that concludes my report.
All right, and the Rural Cities County Roundtable is Tuesday, October 12th from 4 to 6. And I had mentioned to Commissioner Mojo I may have a conflict at the start of that meeting. I have another one that's from 3 to 4 or 3 to 5 or something, and I'll get out of this as soon as I can. And so just note and that's going to be held right here in this room. All right, Brian, anything else for us? Colleen, anything? All right, we are adjourned.